Hi, I am Dr. Punnam Gupta. Today I will explain about the incontinence of urine. Basically, incontinence, what is incontinence of urine? You can't control your urine. That is called incontinence of urine. Basically, urinary muscles or whatever muscles is there, that is actually work involuntary. Then we need to control it. So there is a stress incontinence, overloaded bladder, and infectious disease. Stress incontinence is basically person who is in stress, any kind of stress can be there. That is called incontinence stress, urine. In person who is in stress, like any kind of stress, you can say he has urge to go toilet but he doesn't get the right place to go, that is also is stress. And person who is working long hour working and they don't have time to go there, then evacuate the urinary bladder, then that is also incontinence, stress urinary. In fact, this is the very common in the young generation who is working in the multinational companies and all, but sometimes it's disease, with the diseases, neuropathy disease ho gaya, and then diabetes, high blood pressure, and any cardiac. And third is overloaded bladder, always bladder full, you person keep always full bladder because all the time he is on work or any kind of thinking, that is also called a overloaded bladder, and it's also incontinence of urine. And second is infectious bladder. Infectious bladder can't control the urine. Second is age factor. Age factor is also very important because after 60s or 50s or menopause, bladder female organ become very loose and weak, that can't control the urine. Then we can rehabilitate the person if they know about the what is incontinence, and it is treatable and manageable. You can rehabilitate your urinary bladder, that is called Kegel exercises. You can improve your urinary bladder with the Kegel exercises. But everybody says Kegel exercises, everybody do Kegel exercises, but you need to learn the right way of Kegel exercises. That for that you have to consult the physiotherapist to learn all these things. And apart of this, some people have a prolapsed uterus, that is also is a incontinence, cause of incontinence of the urine. So for these things you need to know how you improve these things. So you have to do bit of exercises and reduce your stress, improve your lifestyle, and exercise should important for the person who has these kind of problem. And if you have doubt about ki I have these kind of symptoms, then you need to consult a physiotherapist, or you can make a urinary diary, so that we can check out with the urinary diary. You will get the from Google, you will get download this diary and try to fill that follow that procedure, how to fill that diary. And if you feel ki there is some symptoms which is match with me, you must consult the physiotherapist who work with the pelvic floor muscles and it is treatable. If you are a person who is, if person is above 60, that is that time I can say it's very difficult to improve the muscles power, but I can say you can rehabilitate yourself, you can manage yourself. So you must consult a physio who work with the pelvic floor exercises, pelvic floor anatomy and everything. If you need any consultation, you can contact to the Lybrate.